I think that's a perfect segue to my colleague, General Callahan, because it's an overall partnership together that's allowing us to continue to improve.
Thank you very much. And it may not sound like we're all on the same team. We all are on the same team. We all just have different jobs to do. So thank you. Major General Callahan, thank you for being patient. We appreciate it. Over to you, General.
Thanks, Chairman, and good evening, everybody. If I haven't had a chance to meet you directly, my name is Chris Callahan. I serve as the Adjutant General and Commander, Rhode Island National Guard. And I happen to be also Dr. Nicole's battle buddy, and also happen to be one of the senior leaders involved with the COVID response. And I was just checking my calendar, and as it turns out, it was a year ago, February 18th, was my first meeting to start dealing with COVID. So it's been a little bit of time for us. Pardon me. So I want to thank you for the opportunity to share with you a little bit about the Rhode Island Guard. I realize you were 90 minutes into the program, so I'll work at speed, but I certainly want to make sure you get the quality and all of the information that you deserve. But I would tell you, for this time around, this was a unique set of challenges that we've never experienced before. Scale, the duration of the response, it required a lot of innovation, as you can see, and we focus and continue to use the term whole of government in our response because it has been, and it's been our role as part of the National Guard to be a stabilizing factor, to be a portion of the response that could just be relied on for resourcing and, for operational logistic planning and those type of things. So we'll get into our sort of where we are in terms of the amount of people that we put forth. We do have some charts for you on that, but I will tell you that this is the most significant domestic response the organization has ever faced in its 382 young years here in Rhode Island. So it's been amazing. We have been working, very closely, as you know, with the Department of Health and Emergency Management Agency and those type of things. But some of the quick takeaways that I share with you in terms of the whole of government response and where the ring fits into things is we were the first state in the nation to create a mobile testing site here and basically set a standard, I think, that a lot of states were able to follow. And I would share with you on the flip side, we were also reflective enough to continue to get better at that as well. I think if you recall, we stood up 3 mass testing sites at CCRI, RIC, and URI. And if you remember up at Twin River, that was the first drive-through and the nation's first rapid testing spot with CVS and the Guard working together. And so we're still kind of at it. We've had a role in a variety of different logistics components, from building and delivering hundreds of thousands of swab tests, a tremendous amount of protective equipment, and you'll hear a little bit more about how we've been involved with the schools. I would share with you that the first sort of 2 large projects that were kicked forward and the team really dug their heels into was the building of the alternate hospital sites. And that really was something very special, where we were able to have the various medical professionals from RIDO, but within the state of Rhode Island, to work with us and to help us build these state-of-the-art medical facilities that could support, at the time, as you recall, a tremendous surge. I would also share with you, just as a matter of course, those particular sites were built after the Javits Center in New York and after the Convention Center was built in Boston. And both Boston and the Javits Center were instrumental in helping us become a greater and more efficient hospital, so that we were not in a disparaging manner, but we were not going to try to just set up a large area with cots and some very minimalized medical support. We knew, based on the science and from what our scientists were telling us, that we needed to have real quality medical there. And so now, I think that we're all involved with the focus on vaccines. We'll go through, I'll kind of walk through those efforts in a moment, but just to share with you that the entire interagency over the last 3 days has vaccinated over approximately 30,000 people. And at the state's two mass vaccination sites, we've been able to get after just under 10,000. As Dr. Nicole mentioned in the upfront, late today we're using, in some instances, there's a variety of references, but we close out today 26th in the nation in terms of both first and, believe it or not, second doses. We are literally in the middle of the pack, as Dr. Nicole mentioned. And so I would like to just kind of walk through our slides and help you get a feel for what we do. So for those of you that are just not really familiar with the Rhode Island National Guard, we are about 3,000 plus service members. We've got 2,000 on the Army side and 1,000 on the Air National Guard side. Our normal look is approximately 770 full-time. That's kind of what our federal full-time force looks like. That's what it takes to keep the organization running throughout the year on a regular cadence. And you've seen the helicopters and the airplanes and the trucks and the vehicles and things like that. And you've seen them on non-training weekends, so you know that it takes a large full-time force to do it. What we would share with you here is that we've had, we don't at this moment, but at one point we had over 1,000 service members working the COVID-19 pandemic, and we'll walk through. You'll be able to see the kind of the sine wave of work. So just a couple of things that I think it's important for lawmakers to take away, and that is the authorities and what helps us, walk through and how are you able to do your job, National Guard. When you look in the left column here, this is state active duty. This is when we mobilize in support of the state absorbs the cost, we work directly for the governor, and it is the traditional duty for, in general, in most cases, a traditional duty assignment for law enforcement. There are occasions when that may not be the case, but for law enforcement and things like that, it's traditionally state active duty. You'll see state active duty. You've experienced it with, Superstorm Sandy, any type of blizzard, and you'll see also that we couple that with the right column. This is called Title 32. It is a federal title, and we've been utilizing that since the third week of March. This is really important, and I think is a strong takeaway for us. This is federally funded and a federal authority. It puts our National Guard members in a federal status, but they remain under the command of the governor, and the governor retains control of the force, although it's 100% federally funded. And so what is important, at least for me, for you to recognize is for this COVID-19 response, this was my preferred duty status because it did several things for us. Number one, it provided pay and allowances and equity with our soldiers and airmen as if they were on active duty and kept them essentially whole with what they would have earned in a traditional federal duty status. We thought that was important. The second thing that I think was equally important was there are greater medical, essentially, benefits to this particular duty status. And I was concerned, remain concerned as well, but was concerned initially about the virus and what it may or may not do to our soldiers and airmen that might get exposed to it. And I wanted them to have a higher level of medical coverage as opposed to state active duty. So those are kind of two quick takeaways for 502F. Not on the slide, although I'll share with you, is our Title 10 status. You might have heard of that before, but that's when we're in a 100% federal status. In Title 10 this year, in addition to all of the domestic work that we did, our 115th Military Police Company was deployed to 7 different countries throughout the CENTCOM area of operation. And that was 162 soldiers that were deployed for a year. and they are the first soldiers to come home, and thankfully all got home safe, and then looked their spouses and partners in the eye, and then there was a dead standoff as to who had it harder, them while they were deployed or the family while it was home dealing with COVID. So, but they did a wonderful job, and so we were still meeting our federal mission there. So you can see here, what have we been doing? And so I won't, necessarily go through all these for you, but our basic battle buddies have been the Department of Health. We've been working the testing site operations, the contact tracing, case investigation. You can see one of the takeaways in this left column that I'd share with you that I think is interesting is the ventilator acquisition and planning. And so, it was a real drive to be able to try to find ventilators. If you remember, 9, 10, 11 months ago, there was a significant concern nationally about the ability to provide ventilation to patients that were suffering seriously from COVID. And so this particular team was amazing. It was a joint team of RIDO, some educators, some ring members, but they were able to reuse CPAP machines. There was a tremendous outreach with some design, and just went after a variety of different angles to get us a greater capacity to have a ventilator for any patient that may need one. The second thing that I would share with you on the ventilators and how the work was done there is it is a really good example because it helped us internationally, believe it or not. The team from RIDO and the Ring and some of our educators were able to work with our two state partners, the international state partners for the state of Rhode Island that the National Guard work with, is the country of the Bahamas and the country of Timor-Leste. And the ventilator team on several occasions was able to meet with the medical professionals of each of those countries to help them get the insights, the innovation, and all of our current tactics and techniques and procedures that the medical teams have been using here in the States to help them in their preparation to deal with the disease. The other thing I would take off this next slide, as you can see, we worked a lot with the Board of Elections in terms of cybersecurity. So bottom right-hand corner, I'll save the top left for last. We had a great relationship with the Secretary of State and the BOE, and did a lot of very quiet professional work there that was both operational security, cybersecurity, with a dotted line to some physical security. A lot of support to the state police to help us with some of our housing of folks that needed that supplemental housing for isolation and quarantine. And we did a lot of support work for Health and Human Services. But I'll take 1 minute here to pause in the Department of Education. The RIDE and Ring relationship is really pretty special. We had a driving intent from Governor Raimondo based on the feedback from the scientists, based on her intent, and based on the feedback from the educators. There was a single purpose to get our children safely back in school in person. And what occurred there was this creation, after the teams were brought together, but the creation of what we call the Education Operations Center, which was a one-stop facilitating sort of hub, so that if you were in education or in education administration, you could talk to one group of sources. Because this was high adventure. It was new. We were blazing a trail here, and it was really taking a lot for our educators and our administrators and our teams to work together and to kind of walk through and do the analysis and rehearsals to make sure that we were able to move forward in a safe manner and reduce risk. That was the number one sort of component here. So pop forward here. So as of today, a little better than 617 folks on. We're working vaccinations, as you can see. Our two major state operations are in Cranston and at the Dunk. And in Cranston, when you go in there, you see all green. When you go in, it's a completely run ring site from top to bottom. When you go into the dunk, you'll see some green, but you'll also see a tremendous group of volunteers that the Office of Healthy Aging and our colleagues from Providence have brought in. You'll see the Wellness Center and other contractors that are doing some of the literal shots there. So that's a hybrid, and that's an example of what I think we'll see more of in the future at the dunk. You look just to the right of that, that's our K through 12, our Education Operations Center. And one of the takeaways that I think was really important is as a joint group, the team from the EDOC, which included educators, ring personnel, medical personnel, administrators downstream within the different school systems, to get the children back into school. Initially, there were over 330 actual in-person school visits to do an orientation and an overview of the schools and to be able to walk through how to continue to reduce risk. And you can see here that over another 150 over the past academic year in terms of getting out to do more reviews of the schools, to teach resiliency, and to just kind of work with the downstream teammates, as they come up with questions, and we try to provide guidance and referencing. We've tallied, you can imagine we're the Army and the Air Force, so every time someone makes a call, we make a note of that. So we have right now over 1,700 individual requests for information or assistance that have been satisfied. Dr. Nicole has spent a lot of time training me and training us, and we have fully bought into this idea of focusing on our high-density communities and our vulnerable populations that are food, potentially medically, and housing insecure. And so we have a single dedicated team that works in the HDCs, falls under sort of RIDO, but there's a ring lead in there as well. And they're just go-getters. It's a campaign. They're boots on the ground. They're making friends, and getting things done. But over 50 testing sites taking care of there. You can see here the other thing that I would just kind of share with you that I think is a takeaway from this particular slide is in the far right-hand corner, because you just don't see them. So one of the challenges, of course, with the disease, and which has been over the last 10 months plus, is this idea of how do you isolate and quarantine folks and anyone that they may have come in close contact with once they've been identified as either asymptomatic with the disease or symptomatic, with the disease. And this does come down to contact tracing and case investigation, very critical skill set that the RIDO medical team has spent literally hundreds of hours fine-tuning National Guard's men and women that have been part of this notification team and have been, at this point, run in some sections. The ring is running large portions of this, but it is nuanced. It requires sensitivity. It requires a sense of awareness, both self-awareness and patient awareness and things like that. So when it comes to interagency partnerships, that one you don't see because those folks work in in the cubes and they just dig in and drink coffee and go hard and try to take care of people. So as we get towards the end here, I just wanted to share with you the timeline. This is important. Just one quick note. You'll see in the top left-hand corner, this is March of 2020. So this is literally about a year ago because we know March is right around the corner here. And you can see these are not terms that are new to you at all, but we just wanted to kind of show you what the focus was in terms of the overall intent. And you can see when we first got started, we were going to flatten the curve, and we did that through testing, surge planning, and getting PPE out, and a whole bunch of guards, women and men on, and you can just go from left to right there, and you can see that through the spring, there was, once the alternate hospital sites were created and built out and set, there was a tremendous effort made in congregate care and what we call CSST, congregate support teams, congregate care support teams, pardon me, so that we could get out and begin what has been referred to as routine or sentinel testing in our congregate care facilities, like our nursing homes and places where our patients were very vulnerable. Bottom left, just in terms of the state active duty cost for this particular side is about $4 million. But what we end up seeing is a change where the feds are covering approximately 75% of that state active duty cost. So the state will end up likely paying $1 million. There is a chance, however, that it will all be 100% federally funded. I think that's the direction we're leaning in with the Biden administration push. And so we continue to move, from left to right. September, it was the reintegration, working with the K through 12s. Pre-election was a busy time for all of us. Security, that there was a heightened sense of awareness. A lot of effort in November to get those HDC testing sites to rekindle the airport testing, and work through December to start the K through 12 and sort of some decentralized testing for our school systems. And then in January, the Cranston vac site came on board. That is also co-located, at the Sakonnet Crossing, Sakonnet Crossings is co-located, of course, with the alternate hospital site, but that is also where you can go and get your microbial antigen virus, MAB, your MAB treatment. I've got to work that. That's Dr. Nicole's. That's the treatment that you get to reduce the effects of COVID, and we're able to do that on an outpatient basis. So you do come into some bigger money here with an estimated federal cost of about $43 million, cost share about 4.3 for the state. But again, we think there's a high probability that will be at 4.3. That'll be 100% federally funded. So I think we're almost there. Task force vaccination, that's what we're doing right now. We're at Sakonnet. We're at the Dunkin' Donuts. We got to do it efficiently, safely. This is just a quick look at how we are, arrayed a little bit. And it's your typical org chart. But what we try to do here is focus on allowing for individual, officers in charge, folks downstream to make tactical decisions so that they can best serve the public. So this particular model has worked really well. And you can see that in addition to the Cranston and Dunk pods, that we are heavily into the planning of a third and fourth and likely a fifth state pod based on some feedback that we have received from the Governor Select's team. So that's kind of how we're arrayed. We'll go ahead and push. When you look at the Dunk, it's 141 folks. Cranston, 141 total. That's what we're looking at. 20 supervisory staff, 104 in Cranston, 17 ring at the Dunk. What they end up doing is in your right column. And then when you look at the Dunk, Dunk is the hybrid, remember. So you have about 17 guard members that are working with 19 folks from the Wellness Center and about 28 from the Dunk that work in terms of navigating and shepherding people in and out. Right now, their doses per week is at about 8,400, and they're going to expand up to 10,000 as needed. The all-green Cranston, Sakonnet pods were 124. They're all ring. We're up to 2,500 a day, about 12,500 a week, 20,000 doses per week. That was what we're expanding to and planning to. So just a couple to close. We're working hard to increase our capacity. We're working to transition to the Pfizer vaccine so that we're able to do both Moderna and Pfizer simultaneously. And then we're also looking to expand, the ring footprint as it is required to do. What went well? So the chairman asked us to kind of take a good look, and be reflective about what went well. And I would argue that the interagency cooperation went well. And it's always bumpy, meeting new people, relationship building. It's always a challenge, but there has been a consistent mutual trust and a singular focus on the purpose of supporting the constituents and the people that live in Rhode Island, that it has been really, really well received. The other thing that I would share with you is that we realized a little bit late in the process that we just didn't realize how much we were relying on each other getting into it in terms of the interagencies, and so everyone was intermingled there. We benefited, sometimes the military can be a little left, right, left, and we understand that, but we also have a background in design and being able to work abstract problem framing. So, to be able to build task organizations that fit, what a problem statement actually is versus the task organization that, you just blueprint out, we were able to flex to that. We got a lot of Dr. Nicole, and I mean, we just had so many industry experts, whether they were medical, HVAC, so many different types of people that that provided us the professional direction that we needed to be effective. There was no use putting something, towards a problem statement if you didn't have the right people working on it. In terms of an area of opportunity, I think where you as lawmakers could potentially help us, but this is more at the federal level, but you should know it. This 502F funding approval and extension was pretty piecemeal. It was a month out or 2 months out. And so it wasn't very regulated, and it made it really hard for Guard members to program, to figure out, okay, am I going to be out of work, for X amount of time? Can I go back to my employer? Is this going to impact my daycare? How does this impact my partner or spouse? So there are a lot of questions when you can't get clarity as to the time frame that you may be on duty. And so part of our recommended changes, things that we need to do better, is we need to work with our CODEL and use your support to get after this 502F. Again, this is good for the state. It's federally funded authorities that stay under the domain of the governor, and so we're here to work on state issues for that. And one of the things that I've fallen short on, quite frankly, is I have not done enough to personally get after and thank the employers of our Guard members. We do this in a broad stroke. We work it through social media. So I've got to circle back and just get better and get after going after some of the eaches here, because the employers have been unbelievable. We talk about a three-legged stool. It's family, employers, and our military family here. So I'll pause there. I think we have hit it. I think we're on time. Is that it for the deck?
General, well done. You were exactly on time, as wouldn't expect otherwise. I know we have several questions. Let me. So obviously the uptick in vaccination distribution has.
Yep.
Can you hear me okay?
We can, sir.
Okay. So obviously the uptick in vaccination distribution has increased exponentially, not just linearly, over the last number of days since you've stood up the Sakanasa crossing area and the Civic Center, the dunk.
Right.
I can't help but imagine the level, to the degree your work. And whenever I say to folks about the military does a lot of things extremely well. As you talked about earlier with regards to mobilizing and getting folks material with an E, not an A, to where it needs to go. You do that phenomenally well, amongst other things. I'm going to just make this statement and ask you to comment on it. Should the Guard have been involved from a state perspective much earlier in the vaccination process? You were involved in the testing process and a whole bunch of other things, as you mentioned there. But with regards to helping the increase in velocity that's needed with getting shots in arms, should the Guard have been engaged, not you specifically, should the Guard have been engaged much earlier to help in the planning of vaccinations that started in December? Because of your expertise and your experience, and you folks do this, which, like you said, you could take the abstract and make it concrete. Comments, thoughts?
Yeah, no. So thank you very much, Senator, with your positive thoughts about the organization. I've shared with all of you before that I'm very fortunate. We've got a tremendous team and a lot of just grit throughout the ranks. So to circle back to your question here, I would share with you, straight away, the ring has been part of the planning process with RIDO at virtually every turn on every subject from the very beginning. And we were part of the vaccination process from the very beginning. The pod in Cranston, as an example, opened up, through a planning process right after, the 1st of January. And that was designed to give it a warm start and to start focusing on our first responders and some of the other members of phase one. So when I hear your question and reflect a little bit more, it circles back to, I think, the fact that what we did philosophically as a state to get after what we considered the most vulnerable population, that was an intensive logistic and supportive effort. And it was slower, but it was deliberate. And so once we were able to meet that mission, and once those metrics, started to show that we could begin to open the door over, while we were working on that, you can tell that the ring and our pharmacy partners and our municipalities, that everyone was sort of in line and getting ready to execute at a greater speed, because we were, again, I don't want to sound obtuse here, but sort of in the last week, the results speak to themselves in terms of the ramp up and where we are, competitive, and I'm very competitive, and we're middle of the pack right now, and we're not satisfied, but we will continue to get better at that. I think the other piece here that is important is that we are continuing to try to improve. And this is what we did as a whole team to become #1 in the nation in terms of testing, and to put that in play. And so that same philosophy is here, Senator, and I think we are in a good place, and I believe that I'm very confident about our future here.
General, thank you. Just to follow up on the actual vaccination planning and logistics.
Yes, sir.
Every team needs a captain, needs a leader, but you have different folks on the team playing, I'll use a football analogy, different positions. From a execution of vaccination logistics and planning, is that you? Because it's not more than one person. Because if it's two, it doesn't happen.
Yeah. Well, I would argue that I would take issue with your metaphor politely. I'm kind of the GM. That's kind of what I do. I look at personnel. I look at talent. I bring people together to get the team going.
Okay.
We have an entire vaccination team that kind of works together in a unified approach, because there's so many pieces to it. What I think Nicole intimated to a little bit earlier is that, pardon me, RIDO and the state and those of us in this line of work are still sort of accountable for the execution of our partners downstream. So when you look, and appropriately so, you should look when you say, hey, why are there extra immunizations, in a particular spot? We're still accountable for what and how, a Walgreens or a CVS or a provider executes downstream, and we can't absolve ourselves of that. So while I understand your metaphor that you can only have one leader, in fact, we have several leaders that kind of synthesize to make a body that kind of steps out on this. It's really multifaceted.
Thank you, General. I'll come back. Senator De La Cruz?
Yes, sir.
Thank you, Chair. I hear a feedback, or I hear myself. Is that better? Okay, well, I'm going to do my best. General, thank you so much for your presentation. Good leaders, they take responsibility, but I don't want you falling on the administration's sword when you were just following orders. It's not sort of Rhode Island Department of Health's accountability, it is directly their responsibility. But what I want to bring up is, in the organizational chart that you brought up in your presentation, I noticed that the chief executive was missing. So I'm just wondering, with our executive branch in limbo and our governor absent since her nomination to the Biden administration, and really Lieutenant Governor Dan McKee in limbo, who's making the decisions? Is it the governor? Is it someone from the Biden administration? You mentioned something from the Biden administration. Who's making decisions for your team?
Hi there. Sorry about that. Senator De La Cruz, thank you for your question, and good evening, and nice to meet you. So really, I think, a couple things here that I would share with the team. Governor Raimondo is still actively involved day to day with our approach here. The team hears from her regularly. She's providing her intent, she's providing her guidance, and she's in charge. What she's also sort of shared with us, and certainly with me and Dr. Nicole, was to make sure that there is an ongoing communication and an onboarding of information with the incoming governor and his team. So when it comes down to, at the end of the day, as we step out and move forward, the decisions are made. Ultimately, Governor Raimondo is responsible for our current administration and remains so and remains engaged. Dr. Nicole is, responsible for our Department of Health and remains, engaged. I'm responsible for the Rhode Island National Guard and remain engaged. So we have thankfully benefited from both those senior execs having a highway of intent that mirrors each other. Each a little different, but it mirrors each other, and we're in a really good place to be able to switch lanes as we need to and move forward.
General, thank you. Other questions for General Callahan? Senator Archibald, is your hand up? Oh, no, it was. Okay.
Yes, thank you. Good evening, General. First and foremost, thank you for your presentation. I'm friendly with very good friends with retired General Medeiros. He speaks very highly of you, Mr. Privacy. You patronize, you're organized, you did a fine job. That said, my question gets at the core of, and maybe it's somewhat rhetorical at this point, seeing that Dr. Scott is no longer in the discussion, but it gets at how we can adapt. So we've used this targeted approach. We've gone in the past week or so from being last in the country to moving up in the herd. What can we do once we've used the targeted approach and we have extra doses of vaccines, to adapt in real time and get that medicine into the arms of people in the mass distribution centers, right? It's all about adapting. You know, I'm just a layman, but that's what's running through my mind. And you're the general, so what are your thoughts on that, sir? Please.
Well, thanks, Senator. No, I appreciate that question, and I want to share with you all that the team is out and running. So I think, as Dr. Nicole kind of walked through with us, you know, we have planned, you know, we've got 2 in play right now, state sites. We've got another 2 that are significantly planned out, and probably a 5th. Part of the process, though, includes likely another 5 plus or minus municipal or regional pods that we're looking at. And so what I'm sharing with you is there is an absolute focus on creating geographically separated points of distribution that allow for both the municipalities to have a very strong but you know, focused on their particular constituents, on their approach, and then, you know, our state-run sites where we can work at a much larger volume. When we are looking at our municipalities, you know, we talk about expectations of maybe 1,200-1,500 vaccines a week. When we talk about those pods initially, that number's kind of too low for us on a planning factor. And so we're going to look to expand those. But I want to let you know that there is planning in place so that there is an ability to ramp up rapidly when we get a significant surge in immunizations, which we do expect. We do expect at some point that we will get an enormous amount, and based on the phasing and the communication of that phasing that's already in play, based on the maturity of the process to be able to make your appointments and some of the crosstalk between those different partners, based on an expansion of our pharmacy partners and what they're able to do, I'm very confident that we're getting after, you know, being able to exponentially, right? Exponentially, I think, is what you're talking about. Significantly large jumps in effective immunization. They just make a word up there, yeah, immunizations.
General.
Thank you. That if I may follow up for a minute, Chairman. So then I appreciate that very much, General. So then there is, from what I'm hearing from you, there is a plan in place to adapt and to take these vaccinations that aren't used and to get them into the hands of those people in the mass distribution centers. Is that fair enough? You're on mute, General. I'm sorry. You're still on mute. There you go.
Okay. Thank you. Sorry about that. So to just one more point of clarification, there is virtually no overage left. So this idea that there are thousands in a you know, on a shelf and not being utilized, they are all, you know, essentially in an arm, or will be in an arm by Friday, weather permitting, and, you know, and not losing the ability to get after the speed that we're looking for. So currently, once we get to this weekend, very likely this weekend, and of course there's been a little bit of a delay based on the weather down south with some immunizations that were supposed to come up over the next 48 hours or so. But by this weekend, we're back on pace, and we are back focused on what the federal government is providing us. And so we'll be in a really strong cadence. There's no overage that I want you to be worrying about essentially by Friday. What I'm kind of sharing with the group is the planning has started so that when we get, you know, 20, 30, 40,000, we get really large numbers, we're able to exponentially jump. And we can do that in a couple of different ways, of course, by bringing in more personnel, by expanding hours. There's a bunch of different approaches that the team is looking at, how to get after that effectively. But I want you to be confident that there's nothing extra on the shelf by the close of business Friday. And then we'll have, essentially, we plan on about a month of stability from the federal government, we hope. and then we could expect an uptick in immunizations.
General,
Thank you, Jim.
thank you, Senator. General, I think those were music to a lot of our ears with regards to some of the key words you said about planning and scheduling. You're ready for that burst of additional whatever might come, wherever it might show up. I would suspect the federal government, I'm not going to speak for them, if they're looking to have excess or extra, they're not going to send it to a place that has a whole bunch, quote unquote, I'll just say sitting around somewhere. I know it's not sitting around somewhere. For all intents and purposes, it is. If it's in transit, it's not in someone's arm. And logistics, I'm not going to tell you how to do logistics. I never will. You folks do that phenomenally well. Nobody does it better than the Guard. Nobody does it better than the Guard. But the music to our ears, I think, is about planning, is about scheduling for that surge. Great to hear that additional pods or regional areas might be coming online. I assume the Guard will be a part of those as well. I see the state clearly moving in the right direction of using our talent and our resources as most appropriately for where they should be used. Where we may not have had that, appears, from where I sit anyway, and some of my other colleagues, it had not been the case. Thank you for doing what you're doing. We'll expect you to do more. We always expect you to do more, and you and your team, right? You're the leader of the team. You're the leader of the band. All the folks and men and women that you have as part of the Guard are doing that and have done that. We thank them for that. We need to continue to thank them for it. But going back to just one question then. Dr. Scott said earlier, I know Dr. Scott's back on the line here, but question for you. The number she presented was 246,000. I wrote it down that became available, and we have 203,000 in people's arms. So the last time I did a quick calculation, it was about 82.5%. So 17.5% are in process somewhere. Part of that might be allocation coming from somewhere. When you said there will be none available on Friday, is that the 43,000 will be in someone's arms by Friday, or half of that? Because the other half, 19,000 we get per week, isn't here yet.
All right, so what I am referring to is what we have heard colloquially through the media as on the shelf or not being utilized. So what our job has been since last Thursday has been to create through our partnerships and through the central sites that the state runs, those two sites, to create an overage. So we put more appointments online. We've created greater throughput to slowly bring that particular inventory, that excess inventory, in line with a programmatic approach to what we expect week to week from the feds. So Alicia, if you don't mind, you know this process a lot of it more better than I. So can you help the senator with that, please?
Sure. Thank you, sir. So your interpretation is absolutely correct. Some of that vaccine is still in transit. As the general mentioned, due to the weather in the South, some of that vaccine is actually delayed at this moment in time. But the vaccine that we have available in state is all scheduled to be administered this week. And so that's what the general is referring to when he says, on the shelf or in our supply. Excellent. We've been working very closely with our providers to ensure that they can get vaccine in arms within 7 days of its receipt, again, because they have a schedule that they need to maintain. But it is our intent to put every shot in every arm as quickly as we possibly can, and always within the 7-day time frame.
Thank you, Alicia. And I guess I'd ask, and we can't necessarily change what's happening nationally as how data gets reported, but from a Rhode Island perspective, we need to, I include myself in that, I need to be clearer than how I communicate to folks what that number really means. But if it's not simple to understand, people turn it off and just say, we have thousands of doses out there that aren't there. I appreciate your feedback. Any last questions for General Callahan? We do have one person who will be testifying verbally. So going once, going twice to the committee.